How many eggs can you really eat per day? Your coworker says only 1 a day, but your gym buddy eats 3 every morning. Online opinions are all over the place. Who's telling the truth? Today we use solid scientific findings to clear this up once and for all. This debate started with an outdated belief decades ago. Back in the 1970s, researchers noticed that an egg yolk contains 186 milligrams of dietary cholesterol. They assumed eating cholesterol would raise blood cholesterol and lead to heart issues. So the 1 egg a day max guideline was born. But science has come a long way. In 2018, the American Heart Association published a landmark study in the top journal Circulation. It tracked 100,000 people for 10 years, and the result was surprising. Healthy adults who ate up to 3 eggs per day did not have an increased risk of heart disease or stroke. Why is that? Because human cholesterol levels are mainly influenced by saturated fats and trans fats, not dietary cholesterol from food. What's more, eggs contain unsaturated fats, the good kind, plus lecithin, a nutrient that helps the liver process cholesterol. Then in 2022, the American Journal of Clinical Nutrition compiled 30 studies covering over 2 million people, confirming again that most people can safely eat 1 to 3 eggs per day and even benefit from them. The world's top health organizations have long reached a consensus. The World Health Organization states there is no evidence to limit eggs to 1 per day for healthy individuals. The U.S. Centers for Disease Control and Prevention says eggs can be part of a healthy diet and most people don't need to worry about cholesterol. The British Nutrition Foundation recommends 1 to 2 eggs per day for adults and up to 3 for those with higher protein needs. Australia's dietary guidelines go even further: no upper limit for healthy people. First, healthy adults aged 18 to 64 with no chronic diseases and a normal weight, like office workers or people who walk regularly, can safely eat 1 to 3 eggs per day, and it's highly recommended. A 2023 study in nutrients tracked 50,000 healthy European adults and found that those who ate 2 eggs daily had a 12% increase in good HDL cholesterol and an 8% lower risk of muscle loss. Eggs contain lutein and zeaxanthin for eye health, choline for brain function, and vitamin D, a nutrient rarely found in food, all essential for the body. Next, older adults aged 65 and above, 1 to 2 eggs per day is ideal. As we age, our bodies absorb protein less efficiently and we're more prone to muscle loss. Eggs are easy to digest and high in quality protein, which is exactly what's needed. A 2021 study from the National Institutes of Health found that older adults who ate 1 to 2 eggs daily had 15% better muscle strength than those who ate less than 1 per week. However, if you're 75 or older with kidney issues, consult a doctor. Eggs are high in phosphorus, which may burden weak kidneys. Children and teenagers can't do without eggs, this superfood. For kids aged 1 to 3, 1 egg per day is enough. Their tummies are small, but their brain development needs lots of choline, and eggs have more choline than any other food. For children aged 4 to 12, 1 to 2 eggs per day. Their rapidly growing bodies need protein for bones and muscles and vitamin A to protect eyesight, like schoolchildren who read for long hours. For teenagers aged 13 to 17, 1 to 3 eggs per day is fine, especially active kids. A 2020 study from the American Academy of Pediatrics found that teen athletes who ate 2 to 3 eggs daily recovered faster after workouts. Always cook eggs fully. For kids, raw or runny eggs may carry bacteria, which is risky for young immune systems. Pregnant and breastfeeding women, 2 to 3 eggs per day is suitable. Choline in eggs is crucial for fetal brain development. Deficiencies may affect cognitive growth. The International Federation of Gynecology and Obstetrics recommends pregnant women get 450 milligrams of choline daily, and 1 egg contains about 140 milligrams. Plus, eggs are affordable and accessible. The iron in them prevents anemia in moms, and DHA supports babies' eye development. Choose pasteurized eggs. Most store-bought eggs in developed countries are. Double-check the label when buying. For those trying to lose weight or build muscle, 2 to 4 eggs per day is optimal. Protein is key for weight loss. It keeps you full for hours, reduces snacking, and boosts metabolism. A 2022 studies from the International Society of Sports Nutrition found that people who eat 3 eggs for breakfast consumed 300 fewer calories that day compared to those who ate cereal. For bodybuilders, egg protein is the most usable of any food, better than chicken, beef, or protein powder. Eat the whole egg. The yolk has 90% of the nutrients. Eating just whites wastes lutein, choline, and other good stuff. For people with chronic conditions, pay attention to the differences. Those with familial hypercholesterolemia max 1 egg per day. The European Society of Cardiology says this group is more sensitive to dietary cholesterol. A 2023 studies in the European Heart Journal found that eating more than 1 egg may slightly raise bad LDL cholesterol. People with diabetes, 1 to 2 eggs per day is safe. The American Diabetes Association says eggs don't raise blood sugar and help with satiety, which aids in managing the condition. A 2021 study found that people with type 2 diabetes who ate 1 egg daily at a 20% lower risk of heart complications. Those with kidney disease limited to 0 to 1 egg per day or as advised by a dietitian. Eggs are high in protein and phosphorus, which are hard for impaired kidneys to filter, leading to buildup in the body.